Hello everyone. This is another class brought to you live from Trinity Chiropractic here in North Carolina. We are going to give a few minutes, let everybody kind of log in and get settled. Again, I'm Caterina Jones. I'm the holistic therapist here on staff, and we're going to be talking about breast health today. I'm really excited about this class. We have some exciting things coming up next week. HerScan is coming in to do ultrasound imaging, which is really nice that we have this available to us without having to get a mammogram first. I know a lot of us do not do mammograms. Some still do, and that's a personal choice. So I'm going to give a few minutes and then we'll talk about HerScan a little bit. Also, we will be open that Thursday, the 20th, for therapies. So we're not usually open on that Thursday, on Thursdays. So if you want to make your appointment, come in and get a 2-for-1 or use your time wisely, we will be here and scheduling some appointments. So yeah, I think we can go ahead and get started. And first off, I will talk to you about our HerScan that's coming out on the 20th. It's the breast ultrasound. A lot of ladies out there with dense breast tissue, you actually, on a mammogram, it's like finding cotton in a cotton field. So it's all cotton. It's very difficult to see. Sometimes you see shadows, you get false positives, and then they send you right for an ultrasound. And then when they do the ultrasound, they can see structures clearer, and then you know how to proceed from there. So a lot of times we'll skip the mammogram, go straight to the ultrasound. The results come to you. It's safe, it's fine if you have implants, there's no radiation. You can go on herscan.com and you can schedule, I think we have about 10 appointments left. So go ahead, and I'm trying to hold off making my appointment to let everybody get their schedule first before I schedule mine. But I will also be having mine done on that day as well. Cost is $235. I know I recently went through insurance and had to have mine through insurance last year, and I paid almost that much. So, and they forced me to get a mammogram before. Was not very happy about that, but that's okay. That's another tirade. I'm sure you'll hear it. Okay, so next Thursday, the 20th, is HerScan. So a lot of the questions is breast massage, breast health. I don't understand. They're there, I wash them, what is the big deal? Well, it could take 8 to 10 years for something to grow or to morph or to tumor into your body. Some is more aggressive, some is a lot less aggressive. But there are a lot of imaging tools. You can get a thermogram, which is picks up heat patterns or veins in the breast. And when something is stuck in the breast tissue, as women, we have a lot of what I call nooks and crannies because we have the milk ducts. Here's an image here of milk ducts, milk lobes, fat. All of that stuff can get trapped in there, in the lymphatics in there also. And it needs to be massaged out. It needs to be cleaned out, because when it's like a party, 1 or 2 people start hanging out, they're like, hey, let's call some friends, and you know what, now we need food for this party, so we're going to call for a blood supply, and then the veins will actually create inverted V's, and they'll create a loop around whatever is calling for a blood supply. And once it gets a blood supply, then it's fed. And when it's fed, it really grows. And so we don't want anything to be trapped in those milk ducts or those nooks and crannies, not getting cleaned out on a regular basis. So a lot, I talk about lymph massage, about pumping the watersheds, getting everything moving. This is just another aspect of that lymphatic massage, and it's cleaning out your breast tissue. Your breast health is a very good indicator of your full body health. Remember, with natural medicine, it's homeostasis. It's whole body working together for good health. So we talked about the ultrasound a little bit. We talked about why it's important to do the breast health, to get the exam. It's not something we're used to in this country. As a matter of fact, we have special forms that you have to sign, giving permission to go through. What's involved is you'll come in, nice comfortable bed with heated topper on it, so you're nice and warm. The windows are blocked from the outside, but also, you know, the blinds are closed. It's very relaxing. I show you how to do the breast massage. I also show you the difference between standing up, leaning forward, if you see any puckering in the breast tissue, if you see when you move it from side to side, is there any bulging in certain areas? Is it feel fuller in some areas? You know, we have all the lymph nodes underneath the arms, we have the lymph nodes inside the clavicle, and even down the sternum. You know, is anything tender? We don't go up in our armpits very much, and we're like, oh, you know, I was talking to a patient and I'm showing the swooping motion. I was like, oh, wait a minute, it's a little tender in there. I have to do some treatment on that. I'll show you how to monitor. And then you'll get so comfortable with it that even when you're bathing, you'll start washing directionally. If you're going to wash, you might as well get extra benefits out of it. We'll talk about that. We'll do a standing up. We're going to do a standing up inspection of the breast. We're going to go through, we're going to feel for areas that might be hotter, might be cooler, might be tender. And then we're going to take each structure and we're going to break it down. Do we feel edges around it? Does it feel like grit, sand? I can remember the first time I learned this from Effie Sperlin. She was a great instructor. She was asking me to describe it, and I was detoxing off of sugar for about 2 weeks. And so everything I felt, I was like, it's not an M&M, it's more like a Skittle, because it had a round structure to it. And then there was another area, and I was like, it's kind of like a rope, but kind of like a Twizzler that twists, and everything was referred to as candy. Detoxing sugar, it's never fun, but it's important. Having that firm description in your mind, and we draw it out on a paper so that we can see before and after the changes. Is there any changes from last year? What happened in your exam last year, or 6 months ago, or 2 months ago? You see the difference when you do the massage, you see the difference when you do the exam, and when you're standing up in the shower, and a lot of times they say do this in the shower. Well, it's a great time because you're soapy, you're wet with the water, things slide better across the skin, and so you feel more. However, when you lay down, you have completely different breast. We found something deep underneath the areola in myself, but standing up, even with the C motions around the breast, I didn't feel anything. But laying down, now all of a sudden there was like a little stone in there. And I'm like, okay, now this is something a little deeper. And then the question was, well, does it move? Does it move back and forth? Does it stay? Is it on the surface? Is it deep underneath? And we mark down all of these things that we feel. I would say 90% of the clients that come, the patients that come in, they're shocked. They had no idea that all of this was going on in the breast. We talk about underwire versus no underwire. Are the breasts able to move? The lymphatics able to move? If everything is strapped down and it's hard in place and it's got underwires that are holding it, you actually get U's indented in your skin underneath your breast tissue. And we have to work that out over time because we need things to move and clean out. Our lymphatics are how we clean everything out of our body. So we need to keep them moving. And if we know anything about lymphatics, the best things to move lymphatics are a rebounder, that gentle bouncing, intercourse, that rocking motion, and a nice exercise, walking, vigorous walking. That bouncing movement is what we need to really gently move the lymphatics. And of course, hydration. If we're not drinking half our body weight in water, then the stickiness inside the lymphatic, because lymphatic fluid is sticky, it can't move. It's like a dam blocking a river. It's sludge. It's not going to move through. So we'll talk about all the different aspects of clearing out, emptying the watersheds, right inside the lymphatics. The first time I did this in class, I actually got nauseous. I had to sit down. I smelled some ginger because I had dumped so many toxins for my body to eliminate it, that it was just too much. And so we do this gently. We clean out the body without creating a healing crisis in the body. So we do the exam standing up, we do the exam lying down, we chart everything, we draw pictures, mapping out the breast tissue. And then I go through this chart, which is been created by Bruce Rind. He's an excellent medical doctor in this field. He does breast health, and he teaches how to clean out the tissues. We laminate this and give it to you to take home. So if you have oil on your hands, or you're in the bathroom, you don't have to worry about destroying it, or I didn't remember what you said. It will map out everything. The arrows show the direction that you're going to do the massage. And you're going to use a nice flat hand when you do the massage. No open fingers. If you visualize you're pushing honey out of a sponge, if you push honey out of a sponge, then and your hands are open, honey is just going to pour through your fingers, and we don't want that. We want a nice, gentle, sweeping motion. Not a lot of pressure, maybe about the weight of a nickel. Just very light pressure, because your lymphatics are right underneath the skin, and they're directional. Interesting thing about lymphatic vessels, they actually, the lymphatic vessels are directional, so say they're going this direction, they have slits in them. So as you gently go over the skin, you're putting a little bit of pressure, and it's opening those slits so that the sticky lymphatic fluid can move out. Okay, so having this visualization in mind will help you, because you'll realize that, okay, well, if I push too hard, now this, instead of opening, is crushing. It's flattening. Nothing can get out. It's just gonna go through the tunnel. So having these visuals will help us remember to be gentle. Be very gentle in these brushing motions. A lot of times, especially in massage, people think if it's not deep, it's not effective. If that's good, then you must do it harder. It's not that, and you will move things much quicker and much more effectively if you do it gently. So step one is use an open, flat hand to sweep in the direction of the lymphatic flow, and that is in the blue arrows. Okay, so imagine your breast tissue is a clock. Okay, on here it says 12, 2, 4, 6, 8 o'clock. So 12 o'clock, 2 o'clock, 4 o'clock. I personally, I go around the clock every hour. 1, 2, it's the more I do it, it's not going to be bad, because I'm doing it nice and gently. And so I just go around the tissue all the way around, because we have lymphatics in here, we have lymph nodes in here, lymph nodes here, lymph nodes here. And so by pushing all of this towards the lymph nodes, anything that's not supposed to be in there can be captured by the lymph nodes. It can be destroyed by our antibodies and our cells. and that's their job. We can also suggest different oils to move the lymphatics, as well as if you have tender lymph nodes, what to use on those. Let's see here. We're going to do this 2 times per breast, repeating it, a second time on each side. The next step is you may need to anchor the nipple while doing the massage. And so what that's explaining is you'll gently press your hand here so that when you lift up, your whole breast tissue doesn't lift up. Because remember, it's directional. So we start at the areola, and so we anchor, and then we go up. And then here we go down, and we swoop towards the lymph nodes, okay? So that is very important, because a lot of ladies have larger breasts, and it gets unruly, and you're like, okay, this is too much, and then you get frustrated, and then you don't do it. We do not want that. We want it to be gentle, we want you to feel confident, and we will continue to go over the massage with you until you feel comfortable doing it on your own. A lot of women will take their hands, go over the areola, and swoop out completely on both sides, up and down, while they're bathing, so that they're getting just a little extra massage in there while they're bathing. Again, take 3 to 5 seconds to complete the sweeps with gentle deep pressure. So that's that real gentle, but visualize what you're doing. Visualize the lymphatics moving out of the lymph nodes, the milk ducts, all of the nooks and crannies. Imagine that, again, you're pushing honey through a sponge, and so you're using these sweeping motions. And then it talks about doing it in the shower, doing it laying down, doing it standing up, all the different ways to do the massage. So if you have any questions about the massage, send those in. They'll read them off to me, and while I'm waiting for questions to come in, I'm going to show you our Medicupping, because once we learn the massage and we do the massage, now we want to go a little bit deeper into clean out all of the lymph nodes. Now, as soon as I say cupping, everybody's like, oh my goodness, I've had cupping. You get these bruises. It's like suction cup to you. It hurts. No, this is not what we are doing at all. These are the cups. You see they're curved at the bottom so that they actually go across the rib cage. They come in different sizes, 3 different sizes, and it just depends how wide your rib cage is the cup size that you need, because some have very flat, narrow rib cages, and in that case, we can actually use one that is flat on the bottom, okay? But most of our clients will use the one that is curved. It hooks up to a vacuum cord, hooks in here. And I was going to demonstrate on these little balloons. I practiced just because I wanted you to see that it wasn't a hard, vigorous pulling. It's a gentle pulling up and pushing in and pulling the tissue up, and it's really increasing the circulation all throughout the breast tissue. It's actually shocking to the patients because they expect it to hurt, and it doesn't hurt. And then when you release it out of you release the suction, and the breast tissue comes out of the cup, they're surprised to see how much softer the breast tissue is, how much cooler it is. It changes so much when you get all of the circulation and cleaning out all of these little ducts. We do 3 rounds of the cupping, because usually the first one, it'll start moving, but depending on how hydrated you are, it may take a little more sucking and pushing in order to clear out all of those lymph vessels. Remember that fluid is sticky, so hydration is really going to be the key to getting your most out of this. we release it, and then I do the massage on you all the way around the breast. We notice any areas that were a concern for us before. We look at them and say, okay, how is this doing now? Is it still tender there? Is that ropey area, how does it feel? Is it less? Is it the area that may have been more congested? I've had a breast reduction surgery years ago, and so this side of the breast here, I get an area about that long of congested lymphatics right before the scars. And so if I'm not diligent with doing my breast massage, then it gets very full in that area. And then when I do the cupping, then it moves it out. I need that extra massage, the extra stimulation to the circulation of the tissue in order to move that out. So let's see. I think that is pretty much it. We go through 3 times. We like to increase the pressure, but the great thing about, and the balloon, forgot to tell you, I had the balloon just to demonstrate that it will gently pull up. It fills the cup, and then it releases, and it fills the cup and then releases, but it didn't pop the balloon. It didn't, create any problems with something as delicate as a balloon. So this is the sound of the machine, because everybody wants to know that first. And so you can see it's just a nice, calm humming, and that's the increase, and then the push out, increase, and then push out. So that's it. Do we have any questions?
We do. We have one question. What can cause the ducts to become clogged?
Oh, life. No, eating habits, having children, and having left, things left in the breast tissue after, whether we nursed or whether we didn't nurse. It can get clogged just from external environmental, things that we're exposed to. It's a pretty good snapshot of the health of the whole body. So a lot of things can cause congested areas in the milk ducts.
Another question. So breast massage is recommended for everyone on a regular basis.
Yes.
Is Medicupping also recommended as preventative, or is that something that you only should do if you know you have an issue?
Both. You should do it as a preventative, and it's a good snapshot on how are my breasts doing? Is what I'm feeling just lymphatic? Is it fibrous? We've seen very fibrocystic breast that doing the Medicupping regularly and the massage became soft, like soft cottony pillows. Just cleaning all of that caffeine. We all know that caffeine creates those little fibrocystic cysts in the breast. And I don't know about you, but I'm not giving up my coffee. There's not much on this world that's going to cause me to give up my coffee. Doing it regularly is, I would say, at least every 3 months, in order to just get a clear, make sure nothing is hanging out in there. It's not a long appointment, 30 to 45 minutes, usually about 45 minutes, because I don't like to rush. Ask questions. But the massage you should be doing every day. If you're bathing, you should be cleaning out your breast directionally. I use this oil. It's specifically for breast massage. It was created by Patricia McPherson from Derwin Holistic University. When I first, and this was 8 years ago, when I first went and had a mammogram 8 years ago, they found 2 areas that they were highly concerned about. And at the time I didn't have insurance. I had to pay up front for the mammogram and the ultrasound. And I'm like, well, if you know I'm going to need the ultrasound and I have to pay out of pocket for this, why can't I just have the ultrasound? Because that's what you'll use to do the biopsy. And they're like, that's not how it happens. And that was it. I had no choice. and there was two clear, definite found in the regular breast massage, that they give you at the doctor, that basic one. They found two clear structures that they needed to look at. So I paid for the mammogram. I didn't know any better. Paid for the ultrasound. Had it done. They said, well, you clearly need a biopsy. And I was like, well, guess what? I don't have insurance, and that was my savings. I just, used my emergency money on having the diagnostic test, and there's nothing else I can pay. So they said, well, this is in your breast, and you need to find a way because you could die. That's exactly what they told me. So I went to the car and I cried and I cried, and I was like, oh my goodness, this lady just told me I'm gonna die. This is ridiculous. How do you treat somebody like this? So I went on a tirade, and of course, and I called my instructor and I explained to her what had happened. And she goes, Papa, don't worry about it. Come on, I'm gonna take care of you. And she gave me this. I didn't even know about the breast massage at the time. I put this on twice a day, morning and night. A year and a half later, I went back. Now I had insurance. They said I had to have a yearly mammogram. They said to me, there was nothing there. Nothing. Both, and they were very hard structures. And so that's my experience with this oil, and that's why I recommend it. Even when they found the issue in my colon, I used this on that area. Apricot kernel seed is the carrier of it, and it's been proven to be able to normalize abnormal cells, and so I highly recommend it. We use this in the office when we do the breast massage.
Is that an oil that can be purchased through this office, or?
It can. We are out of stock because, the breast imaging is coming and everybody's getting prepared. We will be getting more in, and we will let everybody know when it comes in.
Okay, great. Speaking of preparation, we have someone who is coming in for her scan next week, and they're asking if they should wait to start doing any kind of regular massage until after they have her scan.
Absolutely not. The more you clean out of your breast tissue, the clearer image they're going to be able to see. And if doing a massage, this is like the basic, doing the massage, if that will clear something out, then it's less you need to be concerned about on the reading. You'd be surprised, most women have very fibrocystic breasts, and it can be concerning when these things show up and then having to wait for the results. But just by doing the massage, you will already clean things out of the breast tissue before the screening, and then the screening is just going to give you a more definitive picture of what's going on.
Awesome. I don't have any further questions at the moment. We have lots of people saying hello and thank you for the reminder. We have people who you have taught this to, and they have found benefit and need to get back on track. So we appreciate that.
We all need those reminders. I know it's funny. I'll go 3 or 4 days and I hadn't done it, and I'm like, what? I teach this. Why haven't I done this? And then I'll move my oil closer to my shower, and then it's a visual reminder for me. So if anybody out there needs a copy of this, just to have a copy of it for personal use or to share with a friend, come and see us. We will give you a copy for free.
And we just got that question, so come on in and get a copy.
And if you are very far away and you need it mailed to you, let us know. We want everybody to be able to utilize this tool.
For the massage itself, we can do it in the shower or out of the shower. Is anything other than oil out of the shower or water in the shower, do you recommend, you said you put your oil near the shower, is it better to use oil all the time?
Well, I use oil all the time because I've had cancerous issues in the past. I have a family history of, my holding back words on that, family history of cancer in several of my family members, and so I always use the oil. I do it in the shower, I get out, I dry off, I apply it then. I do not like the smell of the oil. Some people think it smells great. There's a lot of oils that I don't like the smell of, and I think it's because I use so many oils working. My body's just like, enough is enough, Kat. You too much. But I put it on after I get out of the shower so that I don't have to smell it. I can put my bra on afterwards and go, or go straight to bed and I don't have to worry about it.
A clarification question around the oil. Is the oil used more medicinally to help, or is it simply to help with the process of actually massaging?
Medicinal. It's medicinal. Well, it does help with the process because, of course, if you have oil on your hands, everything is smoother. Oh, you know what? In the massage, I wanted to also, I talked about the lymph nodes and checking the lymph nodes, but when you're doing the breast massage, it's easy to use the other hand and come down, sweep under the breast into the armpit, gentle pumping, and then all the way up into the clavicle, so you have a nice full sweep. I wanted to throw that in because I didn't mention it before, but it's very important. And it's interesting because when you do it, you might find a lot more heat in here, and then it'll move. And on women who are more thin, when you sweep up, a lot of times you'll see the veins empty out and then fill back up. It's actually a pretty cool thing. So let me know if you see that when you're doing it in the shower or doing it in the mirror, either way. But yes, oil is very helpful for nice, slick movement. And of course, it has oils in it, such as frankincense and such, that help for medicinal reasons as well. Okay, well, I was close to 30 minutes today. I'm getting better. We hope to see everybody here for the HER scan. If you can't make it into our office next week, or you don't, if the spots are all filled, they travel around to different areas. Just check their calendar on their website, herscan.com, and you know, try to get in and see what's going on. Get a snapshot, a healthy snapshot of what's going on, so that we have something to work. And also, if you have a young person, like my daughter's 15, teach them to do this. The younger they start, the healthier their breast tissue will be. They'll recognize, oh my goodness, all of these sodas are causing pain. Or once a month, I have pain in my breast tissue, which actually this oil is incredible for that. When you have that monthly hormonal change and your breasts get tender, 1 or 2 applications of that and it's usually gone. So teach others, tell others about it, have them come in for a consultation or you know, a session so that they can learn themselves how to do it, and just experience it. It's very nervous for a lot of ladies, but I'll tell you, I had somebody recently, for months, her daughter kept telling her to do it, months and months and months, and she's like, I'm gonna do it, I know I need to. It's so funny. She finally came in and she was very nervous, and I went very slow, and we talked, and you know, the way we worked together was we communicated well through it. Every 2 weeks she comes in, she gets her therapy. She says she feels so good afterwards. She's taking care of herself, and that warms my heart to see women taking care of themselves and doing what they know makes them feel better. So thank you guys for your time. I appreciate all of your support on Facebook. I look forward to seeing each and every one of you, and have a wonderful day.
Can I ask one more question?
Sure.
It's a great question.
Okay.
The question is, can you do the massage and castor oil pack? Does castor oil have the same effectiveness? Actually,
Castor oil is good for pulling out things from the breast. If you are doing castor oil packs, thumbs up to you. I do not like the feel of castor oil. I had the fleece. I would wrap and go in the sauna when I was really working to get my breast tissue cleaned out. It is wonderful for pulling things out of the body. I just could not stand the way it felt on my skin. It's very thick and it's very sticky, but it is very effective. And if you can use that, absolutely use it. It is a great thing to do, and the heat really brings out the pulling of the castor oil. So yes, that's an excellent question. I'm glad we stayed on for that.
Okay.
Any others?
We do not have any others. I've posted out there. I did mention that we will post an image of the instructions under this video, and then please feel free to come in and get your copy if you need one.
Sounds great. We hope to see you soon. Have a great day.